Good morning and welcome to the Eclectic Radical. As always, I'm Chris Richards, the Eclectic Radical. My co-host this week is Bess Goden from the Millennial Splaining podcast. And our guest is Julia Doubleday of the Gauntlet. Julia, please introduce yourself for any guests who don't know you.
Hi. So I'm Julia. I have a Substack called The Gauntlet. I started it a little over a year ago, and it focuses very much on the COVID non-response. I started it because I had noticed this dearth of reporting about what was going on, even on the left with COVID, what's continuing to go on. And it's been up for, a little over a year now. And a lot of what I cover has to do with the rolling back of any kind of social or health gains that we got in the early pandemic, but also to do with the sort of long-term project to dismantle even the concept of public health, which I think has been just a rousing success over the last couple of years.
It really has. They haven't just managed to roll back all these COVID guidelines. They've also done things like destroy infection protocols in hospitals for every other communicable disease.
Yes. So I think what people underestimate is in the process of trying to normalize this idea of we shouldn't try to avoid illness. It's fine. Not only is it fine, maybe it's good for you. I mean, that's been a narrative, which by the way, came from the anti-vax side. This narrative that getting sick is good for your immune system. That's not true. That's scientifically untrue. But that's been very mainstreamed in the process of normalizing this idea that your kids are going to get sick all the time. You're going to get sick all the time. Get over it. It's fine. There was within that, it was like a Trojan horse also containing the seeds of the destruction of public health. So all of these concepts of health is a collective project. That's the reason that we used to have very strong vaccine mandates for little kids going to school, because it created a wall of herd immunity, safety for everybody. That wall is sort of being taken down.
Remember when we bragged about things like eliminating smallpox and one day being able to eliminate malaria? Well, malaria is not gone yet, and smallpox may come back.
I think everything, we're going to see a drastic rise in everything, because the philosophical argument for having any public health has been it's just been completely villainized to people, including people like liberals, leftists, people on the far left.
People like Natalie Schuer have been writing these ridiculously insulting not even writing so much as boosting these ridiculously insulting articles by people who aren't even medical doctors, but are like psychology reporters about how long COVID is in people's minds.
Yeah, she wrote a very long article for the New Republic about how long COVID is. Maybe it's real, maybe it's not, which was incredibly damaging, at a time when millions and millions of people, which all of these people are not making this up, obviously. Millions and millions of people are struggling to get this disease taken seriously. And she sort of came in with a hammer and was like, no, fuck them. I wrote a response article actually to that on my Substack, and it gets into the details of what is happening with leftist reporting, and also strangely how there was some good long COVID reporting in these outlets you wouldn't expect it to be. So
business
Times, Forbes, business outlets. And
the business people are both the ones rooting for certain policy changes that they're going to report on, because they want people to know, yes, this is happening. And at the same time, news like people not being able to work is real business news.
Yes. So that was sort of my argument in the piece, is that a lot of business outlets are sort of forecasting we're looking at how this long-term illness, these numbers are increasing, and we're also projecting that nothing is going to change with the COVID response. So those numbers are going to keep increasing. How long can you keep increasing those numbers and have a functional economy? How long can you keep disabling workers at a very high rate and have a functional economy? And actually what we've already seen last week, we had a report come out of Germany that found that their economy last year entered a recession, and that an average worker in Germany last year needed 20 sick days. And in this report, they found that the German economy would have grown if an average worker didn't need 20 sick days. So in other words, this level of illness in society, totally uncontrolled, unmitigated illness in society, is creating these conditions that are leading to recession. Then just yesterday, the same thing came out of the UK. They put out a report that says, hey, we've got this record, not even just sick days, but record long-term illness. So there have been multiple reports showing that in the UK, there's just this rapidly rising amount of people who are leaving the workforce because they're long-term ill. And let me tell you, people don't do that because they're imagining that they're sick. They're very sick. A lot of people are now leaving the workforce. And I think that's also contributed to, you've seen people bragging about these like, oh, low unemployment numbers. Well, when people aren't searching for work, they aren't unemployed. So people who are long-term sick, who report that they're not searching for work, who are not filing paperwork that they are in the job market, who are not filing paperwork that they're applying for jobs, they aren't counted as unemployed. So that'll get you that really low unemployment, and it will probably keep getting lower because more and more people are going to be dropping out of the workforce entirely.
And when they drop out entirely and their unemployment benefits run out, they won't be counted.
Absolutely. And just to add on also, like, to maintain unemployment, you have to fulfill certain standards. You have to for work, you have to go to these freaking job programs they make you go to. It's a pain in the ass to be on unemployment. And you're right, it doesn't last that long. And then you're out of the
and then you're trying to get on disability, which is its own struggle.
Right. It's really, really difficult. Obviously, it's difficult for anyone to get on disability but with this disease in particular, people knowing so little about it, and then the little they do know, often the first thing they read is Natalie Shure saying maybe it's not real. Like that's what I mean when I say that's an incredibly harmful, violent, damaging thing to do to patients that are struggling. And like, you don't have to hear it from me. You can go and look. There are a lot of places online where long COVID patients are sharing their experiences. Like if you go on Reddit and you go to like the long COVID community, you will read these just absolutely heartbreaking stories of people who are losing their livelihood. They're losing their careers. They're often losing their relationships and their marriage because this disease has been so stigmatized that nobody understands it. It's really, really scary.
What worries me is we're going to see history repeat itself somewhat. We already have with the public health mess, but in the 1920s and 1930s, Weimar Germany was one of the first countries in the world to have a mostly nationalized healthcare service. And one of the things that helped the Nazis come to power was posters with pictures of Spanish flu survivors who had been disabled saying, we can't afford to support these parasites anymore.
Yeah. So the parasite language, the useless eater language, I'm very disturbed by the degree to which it's not only become normalized, but it's really started to be adopted by people who can consider themselves to be in favor of justice.
Well, people who I would otherwise have expected were really jumping on to really deeply ableist ideas about physical fitness and how physical fitness is a magical cure for all your health ailments.
Right. Yeah. And,
and I'm not trying to say physical fitness is useless. It's always important to say that people should be in some sort of fairly decent shape for health reasons, but it's not always possible. Our society doesn't allow it.
Right.
In every case.
And also just this sort of like equating of physical health with goodness. So if you're physically healthy, that means you're good. So that means if you're not physically healthy, that means you're bad. And
that somehow, and specifically the idea that everybody is responsible for being a lean, mean street fighting machine in case the revolution comes tomorrow.
Yeah, I mean,
that's not everybody's role in the revolution, number one.
That's not everybody's role in the revolution. Two, like, you can save lives tomorrow by wearing a mask. So if you're not doing that, like, start there.
Exactly.
It's much more, like, I'm not saying you're never going to have to punch fascists or in the street or whatever, but tomorrow you probably don't have to. But you could wear a mask tomorrow.
But you are likely to not want a fascist to cough in your face.
Yeah, this is this is the thing, is that's what I was going to say, is that like what I've seen online is just like this creep of like the things that people are, it's like the Overton window has moved of things people are allowed to say about disabled people. And the useless eater language, which again is Nazi terminology, is very present. I see it in all of these spaces.
Somebody who a lot of people normally respect a lot accused people of who were speaking up against that be a lean, mean street fighting machine or you're a failure language, and were being accused of using that language about themselves and seeing themselves that way. And all these disability activists see themselves as pathetic victims who can't be helped. It's like, no, they're trying to tell you how to help them, and you're being an asshole.
I saw that tweet. I don't know if we're getting in the weeds on like Twitter wars, but I did see that.
I try not to, but it's like it was.
I did see that tweet, and to me, it was just like, wow, this person like literally knows nothing about disability justice. And I think like that's an important thing as well, is that like, at least for myself, like I do read a lot about like the different aspects of oppression within the system. Yes. And like if you're someone who's gone out of their way to like read about imperialism or colonialism and you've never read a book about disability justice, like maybe now's the time to pick one up. But don't really out of your fucking ass about stuff that you've never read about and don't know the first thing about, you know?
Can we show the tweet, or somebody tell me what you're...
Okay, give me a second. I will find it. I have it here.
It up.
Okay, I thought you had it. Yeah, I mean, I think all I was saying, like the takeaway is just that a lot of people who are not at all qualified to speak about disability justice, they don't understand what disability advocates are talking about. Well, they sort of also in the conversation, and they're very loud, and they have these large platforms. And the only time disability features in their timelines is to make fun of a disabled person. And at that point, it's like,
yeah,
there's a second kind of person
the word disabled is not in your entire timeline, except to like dunk on a disabled person.
There's a second kind of person too, who falls into the same category, and this is actually even more dangerous in some ways. There is the person who is themselves disabled in some way that they feel they have overcome. In the case of the person who started the thread that started the Twitter war, they talked about rehabbing from an injury, and how rehabbing from an injury made them become stronger and more physically fit people.
Right. I mean, I don't think that's unusual in any community. I mean, there's women
and one of the people who was most actively defending them was someone who had been unhealthy, had weight-related health issues that were disabling, and feels like he cured his disability by losing a lot of weight. And so every other disabled person can lose a lot of weight and cure themselves too, and that we're just trying to make disabled people fat and lazy.
Can I respond to that? Considering that I am fat and disabled, and everyone thinks it's because I'm lazy. I mean, it's crazy to me, like the default. Like I'm not trying to call out my mother-in-law because I love her so much, but she just defaults to telling me to lose weight to take care of my issues, even though she knows specifically that my issues happen to women of all sizes, that it's not my specific disability has nothing to do with my weight. In fact, my disability causes me to retain weight, right? So if I got rid of my disability, I'd be losing weight. I cannot lose weight until I get rid of the disability. You know what I'm saying?
Here is the tweet. How well can people see this?
I can see it.
All right.
Yeah.
So how is it that the current era of disability activism cannot imagine disabled people outside of the imaginary of being perpetually lifeless, sick, lazy leeches to social struggles, incapable of doing anything, especially if it requires sacrifice?
Okay, so
I find it fascinating.
Yeah, let me speak to this.
I want to do the second one too here, because it's really part of the. Because he's saying the reverse of something you were saying in a way that's really wrong. So many of you invoke the existence of disabled people only when it is time to discuss their alleged and seemingly universal incapacity to do literally anything, as if there has never been a coherent disabled class with universal limitations for physical mental capacity.
Yeah, so this just reads like very ignorant to me. The first one really stuck out to me because nobody in the disabled community came into this conversation. Oh, sorry, could you put it back up?
Yes, I can. Sorry, that's my fault.
Nobody in the disabled community came into the conversation saying, hey, actually, we're lifeless, sick, lazy leeches. That's not what any of us said. That is what you heard. And the fact that he heard that says a lot about, again, like the way the left is conceptualizing what disabled people are saying about our experiences. So what happened is that many disabled people said, hey, I'm homebound. Hey, I'm bedbound. I can't leave the house. He heard I'm a lazy leech.
And notice he characterizes it as other people saying it about disabled people rather than as disabled people speaking up for themselves in that second tweet.
Right. And I guess this is what I was talking about this Trojan horse of this kind of language where it's now become mainstream for the people who've been speaking up about COVID, who obviously were really, really, really marginalized and yelled at and stigmatized by fascist right-wingers at the very beginning. They're now getting yelled at by everyone, and with the same kind of language, of you're lazy leeches. And this is really in response to people saying, well, not everybody can work out. He's like, not everyone's a lazy leech. Okay, well, people who can't work out aren't lazy or leeches because they can't work out. Like that's a fascist idea. So like people aren't understanding the degree to which these fascist ideas have infiltrated their mindset.
Yes, you are absolutely right about that. 100%. And to add on to that, it also assumes that we are in this sort of patriarchal employment scenario. Okay. So that if you can't go to work, then you are useless, means that you have an implied sort of subset of people doing domestic chores for you and supporting you in that fashion. It implies that you have like that entire entity sort of behind you. You know what I'm saying?
I'm glad you mentioned that, because the same people who criticized it, who attack disabled activists over this, frequently attack disabled activists for explaining why they need services like Grubhub or DoorDash.
Yeah.
The Grubhub wars pop back up every few months, and it's annoying every time. I saw somebody who I personally know. She used to be like a good left activist. Not going to name names, but she won't talk about COVID. She continues to go out, live her life. She won't wear a mask. She won't stop dining indoors. And while the last Grubhub wars was going on, she did this mocking tweet that was like, yeah, I'm sure we're going to have Grubhub during the revolution. It's like, bitch, we're not going to have indoor dining during the revolution. So you're the one who's not giving up indoor dining because you've literally said that like you can't have any socializing without literally dining in the indoor part of the restaurant. By the way, I do outdoor dining sometimes. Like that's not 100% safe. I do it. That's a million times better than doing the indoor dining. And they still won't even make this teeny tiny little sacrifice. And they're asking people who literally can't leave their house to stop paying for people to deliver them food, which in a lot of cases, their only option.
So let me just interject here too. So there's a reason for that, right? There's a reason that if you're a disabled person who lives by themselves and you can't go out and get your own food and stuff, it's because society is constructed or has been constructed in sort of this agrarian, familial sort of structure, right? So like you're supposed to have like the man who goes out and works, you're supposed to have the woman, you're supposed to have the kids who support that, and you're supposed to have domestic workers, right? So the conservatives, the right wingers, they're more interested in preserving that kind of society because they are telling you that the people who are no longer able to work in the system have to then become subsidiaries of people who can work in the system, right? So that's what essentially they're telling you when they're telling you that you're worthless and that you can't you know, that you're lazy and you can't fit into the system and you're a sloth, you're slothing off of somebody else, because they're telling you that's the only way you can survive now, right? In this system that gives the men who are able to get the best jobs the more power, the more money, right? So it's a whole mindset that the patriarchy ignores the fact, just assumes that there's going to be somebody there doing your laundry, somebody buying your clothes, somebody buying your food. I mean, a perfect example is that freaking stupid clip that came out when Tucker Carlson had to go to Russia to discover that there are shopping carts in supermarkets that connect via a border.
He's never been to a supermarket himself in the U.S. He's a rich kid.
That's my point. Why do you think Tucker Carlson is able to come on to his show every day looking like a smacking fresh yacht, looking like a fucking yacht club as a person? Why do you think that is? Do you think it's because he does his own clothes shopping? Do you think it's because he feeds himself? Do you think he has his own like hair care products and shit? He does not. He has a housekeeper or a wife or family members that do those things for him. And that is the erasure of so much labor, because that's what makes me really upset. When we were talking about disabled people and not working, and I'm disabled, but I am working because I cannot get any disability. Hey Jira, what's up, girl? You're totally right about that. Because I cannot get disability for my disability because it is feminine in nature and it's not classified as a disability by the disability insurance people. Thank you so much for that. So I have to work anyway. And what I'm doing is working from home. I'm selling things, you know, that I get in bulk on eBay and stuff like that. And I'm still hustling for money. People who are disabled still work. They still hustle for money. In fact, my best friend has cerebral palsy. That's something that you're born with. And so he's been disabled for life, even though it took him years to get disability for it, because that's how effed up our system is. And he has to like break himself to go. He says that his commute is an hour and a half on public transportation because he doesn't drive and he can't get there any other way. And one of the only jobs he could get was to be like a teacher's assistant for special needs kids at this school that is an hour and a half away from his apartment. And then he has to go twice a week, and he literally physically hurts the rest of the week because he has to go and do this, even though he has disability, and he still has to work.
My friend and colleague and several-time guest, Justine Barron, usually on this same topic, though we did also talk about her book on Freddie Gray's, on the cover-up of the Freddie Gray killing. She works harder than most abled people I know, and she's so disabled she can't work.
Yeah.
I mean, that's what our system makes people do. You have to be able to. And when Gira says ableism sounds a lot like Nazism, well, again, the Nazis started by putting disabled people up on posters and saying, we can't take care of these parasites.
Yeah, and I want to also talk about the rest of her comment where she's talking about Aryan Superman. That's actually, I think that the
anti-vax movement comes from the Aryan Supermen saying they didn't need to worry about diphtheria.
Yeah, and the COVID non-response is ultimately going to fuck everyone in society because of ableism. So in other words, at the beginning of COVID, you had some people who wanted to reopen because they're like, well, all the vulnerable people will die off and the rest of us Aryan Supermen will survive and everything.
Yes.
Right? And then since the vaccine, that same process and thought process has been repeated for leftists and liberals.
Yes.
Saying, oh, well, people get the vaccine and yes, vulnerable people will still die. They're going to die off and the Aryan Supermen will survive. And the reality is that nobody can get this virus, which is a vascular virus, which causes organ damage, which causes brain damage, which causes immune system damage. You can read very detailed information about this at the Gauntlet.news. nobody can get this virus twice a year and not end up with long-term health problems. And it was the internalized ableism, it was the socially accepted ableism that made people think vulnerable people are a different category from me and I can't be hurt by COVID. And that's just not true. Like, yes, some people are more vulnerable, but you're not a special Superman that can't be harmed by a vascular virus that you're getting every 8 months.
I like to talk about comorbidities because of a lot of these people who intellectualize vulnerable people and think not me don't actually understand what comorbidids are.
Yes.
Being over 40 is on the list.
Yeah,
that
so
means
I know a lot of
Can
folks.
I just put a capper on what I was making my point about the patriarchy there?
Sure.
Yeah, because crap, no, I lost it. I was so ready to jump in. My mic cuts out every time you guys are talking for some reason, so I can't like jump in over you. I'm so sorry. No, so I think that that kind of response, that sort of like strongman response also, and I don't mean to jump off on a tangent exactly, that strongman response to healing and to being sick is like, it's sort of like you're either 100% or you're worthless, is a very male response because for a very long time healthcare has been in the hands of women until the 1700s when university doctors really started taking over the medical field
and messing it up in many ways. Let's not forget.
What's that?
Medical doctors have messed a whole lot up. The best example is being what happened to the dude who said, maybe we should wash our hands before we cut into people.
That is interesting. I read that in your article, and I want to take a second and just shout you out. I didn't know you before, but I did a little research, and your latest article in the Gauntlet, go check it out. It's pinned on her Twitter, whatever. Profile.
Yeah, I shared her Twitter on my Substack, so if you're on the mailing list, it's in your email. And I also shared her Substack.
Yes, I'm glad. Thank you, because I can't find words today. But yeah, and that's insane that people were so resistant, and that tells me that, you know, when that men, you know, I'm sorry, not men, the patriarchy has this response to it, because for so long people just assumed that their, you know, domestic, the women in their lives, the slaves in their lives, were going to be the people that knew how to take care of them, and were going to do so. So the fact that we have so little preventative medicine, so little holistic approach to medicine, and I'm not just talking like herbalism, I'm talking about understanding your body as a whole and maintaining your health as a whole. It's all of this is because that was the woman's job, the cook's job, the maid's job, to make sure that your house was sanitary.
I mentioned eradicating smallpox earlier. Smallpox vaccines were invented by slaves.
Oh, wow. Yeah. Holy crap. I didn't know that. And and just the cherry on top too is that, again, this is this patriarchy, this sort of ideal patriarchy that I'm describing necessarily means that you have money and most likely are white, historically speaking. So I never ever want to, class reduction, because it's always that's always a part of the situation.
You have to understand that because patriarchy and white patriarchy is prior to capitalism and white supremacy is ancillary to capitalism, and as a result, the ruling class is white and male, which means you never get away from patriarchy and white supremacy in a Western capitalist system.
Right. And not to go too much down this rabbit hole, but I do have an excellent interview that I'm still sitting on. I have to put out from like 2 years ago, and I feel terrible, with Irami Osei Frimpong, who is I think he achieved his doctorate probably at this point, but he was a doctorate student, I think, when I first met him. Anyway, but he's excellent. He's got a lot of really interesting takes on race and gender. But he he and I had a really interesting conversation about how this specific in America, specifically the patriarchy, has to do with the plantation system, and who was a landowner versus who wasn't. So that talk's going to come out soon, and I'll definitely keep you updated on that. But it's an excellent point, and he pointed out a book called "They Used to Be Our Property." I think that's where he got some of these ideas from. So I'm going to put that out there too, that everyone should check that book out.
Yes, and there's another one that I always bring up because it's tremendously important to understand sometimes how your enemy thinks. There's a book called The Sword and the Distaff, which was written by a pre-Confederate slavery apologist named William Gilmore Simms, which is about a Northern woman whose friends and associates are all abolitionists, who marries a Southern planter and is transformed into the perfect plantation matron of the house, who is able to manipulate her slaves against each other and punish them appropriately on behalf of her benevolent overlord, the lord of the manor. And it really explains how patriarchy and capitalism and white supremacism all fit in to this aristocratic idea that the oligarchs of America have always had.
Yes.
And they see themselves as the lord of the manor.
Yes.
We don't remember things like George W. Bush and John Kerry are cousins, not close cousins, but cousins.
Oh, really?
Yeah. And they're also both cousins with the royal family of the UK.
Oh my God. Oh man.
Now for the best part, this is my favorite part because it's because we're talking about politicians here, so it's even better. John Kerry and George Bush, because of their relationship with the British royal family, are both distant cousins of Count Dracula.
Rock on. That, you know what? That I support.
So there's just something to remember for all of you people who are caught up on hating Trump today. I'm sorry, but you just got to bash on W a little bit too. but this whole public health idea not being necessary comes from this Nazi idea that this is a survival of the fittest thing. We're going to follow these aggressively social Darwinist notions about a healthy population, and we're going to use it in order to kill everyone who isn't healthy enough.
Yeah, disease.
Right. It's just it's not. I think also the reality that the equation of like being healthy means you're good. It works backwards as well. People say, well, I'm good, so that means I must be healthy. And like what you were saying earlier about comorbidities, I did want to mention that a lot of folks that are at much higher risk for poor outcomes from COVID, while they're othering this body of people who are supposedly vulnerable, they may be a part of that group. A great example is that I have friends whose parents are baby boomers and they don't mask at all, and they won't listen to any of the information, that's coming out about COVID increasing your risk of heart attacks, increasing your risk of stroke, increasing your risk of dementia. And over the last 3 years, having gotten COVID a bunch of times, they're having heart attacks, they're developing dementia, they're having strokes, and they still won't conceptualize themselves as being vulnerable, even being in their 70s and having had these massive medical problems. The reason people can't conceptualize themselves as being vulnerable is because that group has been so othered and so also stigmatized and treated as if there's something really bad about them.
And there's a total misunderstanding of the medical term morbidly obese, where people who don't understand the medical term and are picturing what I would call just fat phobic stuff, do not realize what morbidly obese actually means, what a small amount of being overweight compared to what they might think of as being morbidly obese actually is.
And there are also many invisible
Arnold Schwarzenegger, this is the best part. Arnold Schwarzenegger, while being president of the Council on Physical Fitness for the president, had elective heart surgery because he was medically morbidly obese. Now, when people think of morbid obesity, they do not think of Arnold Schwarzenegger, do they?
No. They think of the reality shows from the 90s where somebody had to like take a wall out of their house so that
this tails right into this idea of being physically fit for the revolution. Some of the people you think are the most physically fit are morbidly obese in medical language.
Yes. Absolutely.
Because that extra muscle weight is not any more healthy for their body than the unhealthy weight that they all make fun of.
Right.
Yeah, and there's a lot of medical conditions that are invisible, and
yes.
the way that people, one, they can't conceptualize that somebody that doesn't look disabled to them, which as far as I can tell, basically is like you're in a wheelchair. That's like the only public conception of what disabled is. Yes. If I'm not in a wheelchair, then I'm not going to have a bad outcome from COVID. Not true. Not only that, but I think even looking at themselves. So people will say like, well, I'm not high risk and have 5 underlying conditions, ADHD, depression, anxiety. Those are all underlying conditions that make your possible outcomes from COVID worse. You can have underlying conditions that are undiagnosed, like POTS, which I had for years, which is basically, if you've noticed that you get really faint when you stand up, that can be a sign you have POTS, and that makes you higher risk for long COVID. There's so many conditions that make you higher risk for long COVID or higher risk for a worse outcome from COVID. That being said, even if you have no underlying conditions, you can still develop long COVID. And what's happening to a lot of long COVID patients is they're unable to work anymore. And when you're unable to work anymore, this society disposes of you. It does not support you. It does not want you to exist. It tries to kill you in a million different ways. And so like when I talk about my decision to wear a mask in public, yes, I do it because it's the right thing. I do it because there are vulnerable people everywhere. I do it because I want to protect folks. I also do it for myself. I don't feel like I have a choice. Like, I don't know about you guys, but I don't have a trust fund that I can live on for the rest of my life if I suddenly get long-term disabled by an infection, which can happen not only after any infection, but your risk is cumulative with more infections. So if you're like, I had 2 infections, I had 3 infections, I had 4 infections, and I feel okay, guess what? Your risk after your 5th infection is cumulative. So you have an even higher overall risk after your 5th infection of developing COVID.
You can have heart damage from COVID and not know it and think you're healthy.
There are tons of things that can happen to you because of COVID that you will not know about. Here are a few examples. So for example, cognitive damage is common after COVID. And many people, yes, some people have brain fog. So they have cognitive damage to the point that it's disrupting their day-to-day life. Yes. A lot of people don't know they have it. There's also, like I mentioned, immune system damage. The result of damaging many, many people's immune systems is really clear all around us. We're seeing surging fungal infections, surging TB infections, surging RSV infections, which by the way, they did a study that proved that kids were 40% more likely to have a bad case of RSV after having had COVID. They have, it's not just speculative at this point. They actually took the information we had about COVID damaging dendritic cells, damaging T cells, and they designed a study to say, well, is it true that kids
one of the first
get RSV? And they were.
One of the first long COVID studies said, oh yeah, kids are more likely to get long COVID than adults. And then that was completely forgotten when it was the whole rush to get kids back into school came.
Yeah, I think there's still a lot that they're figuring out about the incidence of long COVID in kids. But I will say one thing that is making their risk higher is that a lot of them are not vaccinated. So a lot of people, because they were told,
kids don't have to worry about COVID.
Right. This is a heavily unvaccinated population. And I think another thing people are really misconceptualizing is, again, like people are only aware of disability if they can see it. Same thing with illness. So they think about COVID as, you're sick for a week and then that's it. what we're finding out about COVID is that it has a very long tail. And there are a lot of viruses, not just COVID, which can cause health problems long term. Like you were saying about the Spanish flu, led to a big wave of heart attacks 20 years later, a big wave of Parkinson's disease. And what we've seen with COVID is that the post-COVID risks of all of these things are really high, and we're giving it to people over and over and over again. We've also seen one of the main candidates and most likely candidates for really being the underlying sort of, I don't know what the word is, but the thing that's, I don't want to say causing long COVID because COVID causes long COVID, but one of the things that's pretty consistent in long COVID patients is they're finding viral persistence. They're finding that these people have COVID that's hiding out in their bodies and is still affecting them and doing weird stuff. Which
chickenpox does. That's why you get shingles when you're sick.
HPV does it. HIV does it. Like, this is not a new concept, but
mono.
Yes. And actually a lot of viruses that we didn't think could do this probably are doing this as well.
I think, and I could be wrong about this, someone found a link between mono and several conditions that were mysteries for years and years and years. It might have been that they might be caused by monoviral persistence.
Yes. So we found that, the people who study this found that MS is a result of an Epstein-Barr infection. So again, this virus is brand new. We don't know what it's going to do to people long term, but we certainly know that in the short term, what we've studied, it looks very, very negative. So not dealing with that right now, it's really a choice to lean into this idea that there's some special group of people that aren't going to be harmed by COVID, and I'm part of it. And I'm telling you right now, that's not real. And the reason you believe it is because of ableism.
even the people who can hide out in a bunker are only safe if nobody else in the bunker has COVID. And so you would think that, but which is of course why you hear about all the COVID precautions at the World Economic Forum and all the really tight COVID precautions around certain world leaders who don't admit to being careful about COVID in public, and sometimes they still get sick.
Right. I mean, it's a good example. I think it's a good example for everyone of like what the lack of solidarity does to you. And this is true in every case. I mean, when you live in a country that doesn't support people, doesn't have any safety net, then you're going to encounter homeless people. You're going to encounter people with drug problems living on the street. And rich people are just so incensed by this. They're like, oh my God, I had to see a homeless person. It's like, yeah, because that's what happens if you don't have any solidarity with the people in your community. And that's hardly the worst punishment that could happen living in this society. But that being said, like, yeah, you can certainly assume that it's only other people that are going to be really affected by COVID. But the reality is that by not having solidarity, by not masking, but also by not advocating for real structural changes like clean air, like ventilation, like filtration, you are going to be sick all the motherfucking time. 20 sick days a year, that's so many. And that was the average. I mean, and they have paid sick leave. We don't.
These European countries allow up, most Western European countries allow up to a year of paid sick leave. Almost no one needs it.
So
almost no one takes that much.
In this country, you're just going to be working through that, or you're going to have your kids home some crazy amount. I mean, I see people who are just completely in denial that COVID's still out there, and they're on the internet. Actually, I saw someone yesterday posting like, no one would ever believe me, like the level of sickness you get when you have young kids. And all of these people who had kids 20 years ago are like, no, this is not normal. Like, you are, one, you're giving your kid COVID multiple times a year. But two, you're giving them a disease which then damages their immune system. And not only does that damage to their immune system make them more susceptible to viruses, because society is broadly more susceptible for viruses, there are more viruses and they're spreading more often and people are getting sicker. Like,
and everybody's forgotten that the quote unquote normal childhood diseases killed and crippled children all the time. Until we came up with vaccines to mostly eliminate them. And that was when kids started living longer and being healthier.
Yeah.
Right.
And this idea that it's normal for kids to get sick, you shouldn't stop them from getting sick. No, stopping kids from getting sick as much as how we have fewer dead kids every year.
Yeah.
Yes. And also, I mean, there's so many issues with this so-called theory. It's not a theory. It's just a bunch of bullshit that somebody decided to mainstream when right after we reopened.
People have been trying to mainstream it forever, and COVID was the perfect opportunity. I point out Bobby Kennedy Jr. for this because he was campaigning against the measles vaccine 20 years ago.
But it wouldn't have been mainstreamed if it weren't for mainstream liberals starting to.
That's right. Jenny McCarthy and Bill.
About the Washington Post, the New York Times, the Biden administration, all of them saying over and over again to parents, hey, we noticed how your kids are totally fucking sick all the time. That's good for them. That's not true. That's a lie. And it's a lie to force them to normalize this rate of illness. Illness is not good for you.
Jenny McCarthy.
It's never good for you.
Bill Maher, Arianna Huffington, Mayim Bialik. I'm going through people in my head. There are about 20 or 30 celebrities who have been trying to mainstream Bobby Kennedy's anti-vax obsession for as long as Bobby Kennedy has been obsessed with it.
Oh my God.
COVID was the best thing to ever happen to them because with the way that public knowledge about the vaccine was manipulated on all sides by the corporate people developing the vaccines, by the government people pushing the vaccines, by the anti-vaxxers lying about the vaccines. Nobody feels like they can trust any of this media health information anymore because it's been conflicting, because everybody has lied about something at some point.
Yeah.
And because, I mean, it's obvious. The one thing that the anti-vax people have seized on that is true is the degree to which the government has blatantly been making Pfizer rich, even at the expense of the other vaccines that you can't get anymore because they were competing with Pfizer. People don't really understand that some of those vaccines that disappeared because Pfizer didn't want them. Pfizer tried to stop Novavax from ever coming on the market.
Capital.
And see, one of the vaccine companies the anti-vax people see as the enemy has actually been helping the anti-vax people get vaccines off the market.
Oh my God.
Because it benefits their bottom line.
I would also say, so I mean, I think this narrative that got mainstreamed in winter of 21, 22, that getting sick is good for you, which again is anti-vaxxer idea. And it's really easy to also take that argument apart. There are two things I like to say. One is like, we clean the water. We don't give kids cholera. So the next time they get cholera, it's not as bad. Don't be an idiot. But that's what's being suggested. Don't clean the air because, you know, let's let them get sick. So then next time they get sick, maybe it's not as bad. Like, this doesn't make sense. One, but two, there are countries all over the world that don't have the level of public health and protection that we've had for 100 years. The kids aren't Supermen. They just die sooner. Like, that's what happens when you don't have disease control. We know
that's why
all of human history.
That's why this time of the year you get inundated with Save the Children and St. Jude commercials.
Right.
So
let me bring up really quick, like this attitude is, you know, building on what we were saying about using illness as eugenics, and you know, this attitude is almost understandable if you look at it from a perspective of somebody who is ultra rich in the ruling class or upper class, and they have like the best healthcare, right? I mean, it's a whole other story if you are a kid who has no health care getting sick all of the time. Because if you have health care, you are treated early, you are given antibiotics, and you end up being okay. I mean, it's not great.
Yes, but let me also say that that's how they think about it, but it's not really true. So in other words, like yes, it is true that they're going to have better health outcomes, but is it true that they're going to have better health outcomes than if there were public health and their kid just didn't get sick? No, it's not. And that's how they're getting their ass kicked now. That's why the UK and Germany are going into recession, because they made everybody so sick all the time.
Let's
Right.
remember that our first president, our first and only president in a wheelchair, was also at the time our richest president.
So
FDR came from a rich family, but he still caught polio.
Yeah.
So
but that's the thing, is that like they have an idea of how they are completely untouchable, and it's not true.
Sorry, I think Bess is trying to talk.
I'm so sorry, you guys. It's hard for me to know if you can hear me talk or if my microphone is cutting out. I'm so sorry. I don't mean to be that guy. But next time I'm gonna like, you know, put my face on and like actually use my camera, and maybe I'll just like raise my hand when I want to talk. That might be easier, because I don't mean to cut you guys off. I'm trying to agree with you. But I wanted to bring up this idea that that rich people, you know, that rich people have this idea that they can sort of bunker away. They can sort of isolate themselves from the rest of the working class, so that the working class is disposable and screw all of them, and you know, it doesn't affect me if disease spreads over there and whatever. And I want to point this out because if you look actually at how the Black Plague operated, like they assumed that it was a poor person thing and that they could isolate themselves from this disease, but it became airborne, I believe, or it was transmitted through rats, right? And
I think it's fleas on rats, yeah.
The fleas on the rats. That's why you should never pet a squirrel at a national park, because their fleas carry the same plague.
Right. Okay. So you can't isolate yourself from that, right? You cannot fully isolate yourself from a variable that you don't know exists.
Even rich people had fleas and lice in the Middle Ages. It's just a fact.
Absolutely. And of course they had the same rats running from the shitty part of town to the good part of town. Of course they had a rat stowing away on somebody's horse and just, you know, all of a sudden.
We live in a community. They don't want to believe that we do, but we do.
And cats and dogs were the privilege of the rich in those days, which means rich people were actually exposed to fleas more often, because your cat and your dog kills the rat, but it also gets the rat's fleas.
Right. Oh my God. Yeah. So in a similar way, right? Like
I wish more rich people would read Edgar Allan Poe, The Mask of the Red Death.
Oh, I read that. Yeah, I read that during my like plague readings in the OG part of the pandemic. I was reading all these different books.
Like what you were saying in your article, Julia, about you know, about that you cannot avoid these things being transmitted by air at this point, and that you can't avoid like you cannot isolate, right? Like, so taking that example and putting it into the modern day, as like if I were Nancy Pelosi or something, okay, like I had her status, right? I couldn't go to a private enough medical facility where people were doing the right things enough that I couldn't be infected by somebody who of the lower class, right? So in the same way, we're finding out that COVID it transcends class because of it, right?
Yeah, this goes back to Tucker again. Can Tucker hide from his servants?
The thing is, if super rich people like really understood the risks of COVID, and I think maybe a few of them still know how to do it, it's still incredibly taxing. Not on the money side, which it would be incredibly expensive, but like along with upgrading filtration and ventilation anywhere you go, you also would need to test every servant that comes into your house.
Yes.
Your mask. So you could do it, but the reality is people don't do it, and like people still want to socialize, actually. So I mean, yes, you know, if you want to hide in your mansion and like wear a mask when you leave the house, I mean, I do that. I wear a mask when I leave the house. I'm just saying that like a lot of these people who they don't want any inconvenience to touch them, they're not even willing to do what it takes to live in this society and not get COVID, because it's a mild inconvenience, you know?
Yeah.
And even the deniers who got long COVID are still not arguing for better public health. I mean, I remember when Leanna Wen came back saying, I had pneumonia and it lasted, but she hasn't talked about changing policy.
She is bizarre. Yeah, she is definitely up there in terms of the.
She was the reason she was qualified for her job with the Washington Post in the first place is because she had been the public health commissioner of Boston. That's scary now when you think about it. She was in charge of a city's public health.
I mean, to start with like a very, very easy sort of next steps, what should be done? Like, obviously, ventilation and filtration should be upgraded in every building. It would be so easy for them to do this, and it would drastically reduce the illness we're all dealing with. We have the technology to do it. We're just simply not doing it. And it's arrogance and stupidity. Like, it's the people in charge not understanding how this is going to affect them.
We moved out at my work. We actually had so many ways that my job has changed because of COVID. We moved out of a building with older ventilation and put everybody in a building with better ventilation. And then to keep that building from getting crowded, they did a rotating schedule where like two-thirds of the office that can be is out of the office for 2 weeks and only in the office for one, which cut the number of office staff in the building down by 2/3. They still give free masks. They do better for sick time than some of the other competition. So it's not even employers who want to do it can do it and are benefiting from it. But you've got all these people who are just pushing through.
Yeah, I mean, it's really just a strategy of denial. There's not any strategy. The strategy is let's pretend it doesn't exist. And
I think there is a strategy.
Yeah.
I'm going to go back to the 19th century, and I am going to bring up an economist named Thomas Malthus.
Okay.
Thomas Malthus wrote a book, his defenders say ironically and tongue-in-cheek, but you should never be sarcastic in print. Thomas Malthus wrote a book about how population, if it grew too far out of control, would make the rich poor. And so to defend themselves from the poor people of the world, rich people needed to put the poorest people in the unhealthiest places so that they got sick more and died sooner.
Right. It comes from this idea that there's a finite amount of resources, and if the rich don't grab them all before,
the thing is, like, yes, I think there are definitely billionaires who, like, their plan is that like most people are going to die, and that's why they don't care about like climate change.
I'm not even saying I'm not even thinking necessarily most people. I'm thinking it's just good for us if poor people die a lot.
Yeah, I will say though, the thing is they've bought their own bullshit. So in other words, like when you look at like the people, like you were saying, it's like there are millionaires, billionaires, and elected officials that are taking measures to avoid COVID, but they're still getting COVID. And like the fact that they're still getting COVID tells me they don't understand what the problem with COVID is. Like they don't understand it. And like when I say there's no strategy, what I mean is that the WHO just recently in the last like couple months started to come back and be like, oh, you know what? There should be universal masking in healthcare. They just came out and said this. And they said, there's still a pandemic and we don't know why people are acting like there's no pandemic. And I feel like this feels like a lot of ass covering to me because they did years of minimizing language. And now all of a sudden they're coming back and saying, why aren't you guys doing anything? Like, why are all of these states not doing anything? And I think there's enough information at this point that people within the WHO understand that there's no long-term way to live with COVID by ignoring it.
Well, let's name drop a specific billionaire. Who is the single biggest donor in the world to the WHO?
Bill Gates, right?
Yeah, that's the one. Yeah. Something like half of their funding comes from the Bill and Melinda Gates Foundation, which is hilarious. And he can't get her name off of it because, divorce may be forever, but so are trust funds.
Yeah.
So because he is the most powerful and significant individual donor to the World Health Organization, He has had a lot of say in policy that he shouldn't have for many years. Things like which company's vaccines get sent to which country. He's been a notorious defender of vaccine patents that has led to the offloading of inferior product by cost-cutting corporations that just want to get rid of stuff that's failed quality testing in countries like Samoa and Kenya that have led to real public health emergencies that people in those countries have blamed on the vaccines, when in reality it's a billionaire and cost-cutting corporations ensuring they get bad vaccines.
Yeah.
There was a measles outbreak in Samoa that happened specifically because of cost cutting and bad. But anti-vaxxers in Samoa had this huge media success from it, and as a result, vaccine skepticism in Samoa is tremendously high. It wouldn't have happened if the WHO was run professionally and corporations cared about the quality of their product when they weren't making money. But it happens anyway. And Bill Gates has been the best friend to anti-vaxxers the world over while claiming to support vaccines.
Yeah, I think the vaccines being private and profit driven is just bad optics regardless, I mean, and I also will say that another thing that's driving anti-vaxxer success in the age of COVID, I was talking about earlier how the press decided to mainstream this anti-vaxxer claim that getting sick is good for you.
Yes.
That absolutely has led more people to be hesitant about vaccines, because if getting sick is good for you, why would you try to avoid that in any way?
Exactly.
And additionally, in the process of normalizing COVID, there are other things that people are observing. So for example, a COVID infection is very bad for your vascular health. Your risk of a cardiac event after a COVID infection is much higher for like as long as 18 months after having COVID. So heart attacks, strokes, blood clots are all rising, especially among younger people that typically wouldn't have a fatal heart attack.
Athletes.
Now, the fact that the CDC, Joe Biden, nobody comes out and says, hey, by the way, if you have COVID, you're at a much higher risk to have a fatal heart attack, means that when people are trying to explain what they can anecdotally observe around them, which is more people dying of heart attacks, the only explanation they're seeing is that it's the clot shot, it's the shot. And you'll see it anytime now when you see like younger people dropping dead in the comments, it's all people saying
it's all the anti-vaxxers saying the COVID jab got them.
And yes, okay, like that's misinformation, but if you don't give them the real information, if you tell them, yes, you're correct, people are having heart attacks and it's from COVID, then you are throwing fuel on that fire. And the reason they won't do it, the reason they won't come on TV and say COVID is responsible for a lot of fatal heart attacks is because they want you to not avoid COVID. They want you to go back to work. They don't want you to mask. They don't want you to talk about it. They want you to treat it like it's no big deal. So how can you tell people to treat it like it's no big deal while you're telling them it could give them a fatal heart attack? You can't. So they had to choose, and they chose to throw the vaccines under the bus. So I really hate it when I see like the New York Times or the Washington Post just like hand wringing, like, oh my God, what's happening with all these anti-vaxxers saying that the shots are causing heart attacks? Write the article and write it the honest way. Say, heart attacks are up because COVID causes heart attacks. Say it. Or else you're just helping them.
Just the other day, one of the people who really... Go ahead, Bess.
I just wanted to say, well said. Go on, Chris.
Just the other day, well, other week now, but not too long ago, Brett Weinstein, who was originally made into a local celebrity up here in the Pacific Northwest because he's such a big racist, and who became a much more successful sort of C-list internet celebrity when Matt Taibbi pointed out that his COVID denial was being censored by YouTube because he was lying about shit. Went on Joe Rogan to recycle bullshit. Straight people don't have to worry about AIDS nonsense.
Oh, Lord.
Oh my God.
Yeah, I saw.
And it is I said before, Bobby Kennedy Jr. has been trying to get traction for his anti-vax crusade for years and years and years. COVID has been a gift from his Pope to him because he is enjoying more celebrity than he has enjoyed since his heroin bust.
Well, it's the shock doctrine, right? It's disaster capitalism. It's like all these libertarian use this disaster.
We have a man who is considered by way too many people the most legitimate independent candidate for president, who was at a Nazi rally for medical freedom, right, where he implied that the reason Anne Frank was hiding in the basement was because the Nazis were going to vaccinate her.
What?
Which is exactly the opposite of the Nazi attitude about vaccines.
Right.
Oh my God. I gotta make like a TikTok of all of his just most awful moments.
The thing is that if anybody else had said that, yeah. The whole trouble is that there are people who don't know who Bobby Kennedy Jr. is, who hear Bobby Kennedy because of their age and think, oh, he must be great. He's Bobby Kennedy's kid.
Right. No,
he's not. But he's really
on the strongman thing too.
This is
a lot of him with his shirt off.
Oh yes, his physical fitness videos.
Yeah. Bess, I wanted to sort of also agree with what you were saying about the intersection of patriarchal violence and ableism, and also say that even the anti-masking stuff has such a strong strand of toxic masculinity in it, and it's in like a very goofy way. Like, I don't know if these adult men realize how ridiculous they sound and are when they essentially feel that they're too big and strong for COVID to hurt them.
They're too masculine to wear a mask.
But
their masculinity will protect
out
them.
Of this boyish fantasy of just like, well, if I'm strong, I don't need a mask, and if I'm wearing a mask, that makes me weak. It's like, it's sort of like saying like a condom makes you weak because
I'm not going to wear no condom.
STDs. It's like, that's goofy, man. Like, that's goofy. And honestly, like, I think so many men like really succumb to the anti-mask peer pressure because of other men being like, you're a pussy if you wear a mask. And it's just we need to be beyond this in society. Like, this is too goofy for me.
I'll be totally honest, and I'm gonna take my lumps here. I was masking for a while, and as fewer and fewer people were masking at work, I felt more self-conscious masking. Why am I still doing it?
Totally.
Yeah.
And I stopped for a little while. And then I started working at masking on work again, because it's like, oh my gosh, what if my luck runs out?
I stopped masking after, well, I didn't fully stop masking, but I started like doing indoor dining and stuff after I got vaccinated. I went on this big trip in 2021. It was right before Omicron. And then Omicron happened, and it was like at that point that I started to realize, oh, this like narrative we're being fed is not true. Yeah. Like, essentially, we were told that breakthrough cases were extraordinarily rare. And then we were told that if you're vaccinated, nothing bad is going to happen to you. And then during Omicron is really when I was watching closely to see what happened. And, 200, it was a very, very deadly wave, although it was portrayed as being super good news. Like the New York Times every day I was waking up.
Yes.
I was just being like, good news, more people are dead. And
look, Omicron is mild.
It was like almost 200,000 people who died in 10 weeks. It was like this really crazy mass death event. But instead of framing it that way, the media kept doubling down on like, this is
the last one.
So that's the point at which it diverged for me, where I was like, okay, these people are trying to sell us back to normal. This is propaganda. Yes. It doesn't matter what happens. It doesn't matter if hundreds of thousands of people die in 2 months. They're not going to change their story.
That was the same time when the most influential podcaster on the quote unquote left started calling it the Omicron cold and platforming the anti-vax people.
That?
He's not a leftist at all, but Jimmy Dore has a massive amount of influence among people who have lost faith in the quote unquote progressive democratic establishment.
Yeah, jumping on the Jimmy Dore wagon for a second. Well, I was on the Jimmy Dore wagon. That's why I'm very vocal about it these days. I feel like I was duped in a lot of ways.
He's always been a reactionary, is the secret.
I mean, I liked his fire, and I liked his sense of humor, and that's what attracted me to him. And that's why, especially during the early days of COVID, nobody really knew what was going on. And, I was attracted to the way he put things. But here's an important part of his narrative specifically is that his argument that children should get sick builds natural immunity, right? Like, he uses that word natural immunity a lot. And it is not like at this point in our COVID journey, we've seen people get infected over and over and over again.
There is no durable immunity.
This is not toxic.
The idea of natural versus vax immunity was always the stupidest thing in the world, and shows a total failure to understand how vaccines work. But go ahead, Bess.
There's that, but there's also the fact that different viruses behave different ways. So, like, if you get measles once, you do have durable immunity to measles. You won't get it again. That's true of
mostly true.
Some viruses and bacteria and some vaccines afford you durable immunity. COVID does not and cannot, and that is something that was argued about very early in the pandemic. Some scientists were saying, once you get it, you're never going to get it again. Then after the vaccine, it was, once you're vaccinated, you're never going to get it. Okay, you're going to get it once and you're never going to get it again. It was this sort of like frogs in boiling water.
But the very people who say COVID is like the flu couldn't wrap their brains around the fact that you need a new flu vaccine every year for a reason.
Yes.
Right.
And this both Bobby Kennedy Jr. and too many of the pro-vax people both have this same failed understanding of immunity and vaccines entirely.
Yes.
The vaccine strengthens your body's immune reaction to a specific pathogen, but it is not a magic bullet. Even people with the measles vaccine can catch the measles if exposed to enough people with the measles in a situation where enough other people aren't vaccinated. This is why you have measles outbreaks at colleges where the vaccinated versus unvaccinated percentage has gone out of whack. Mm. Vaccinated people can get the measles from unvaccinated people who catch it.
People are getting COVID over and over again. A lot of them also have damage to their immune system, which means they're going to mount not as good of a response.
Exactly. But herd immunity, which we got this fake idea comes from getting sick over and over again. Herd immunity is a term from vaccines, where herd immunity, the fact that 99% of the people at your college are vaccinated, is why you don't get the measles when you go off to college.
Right.
The reason we see a rise in measles outbreaks is because people like Bobby Kennedy have been listened to more and more.
Right. And the thing is, there are certain pathogens that mutate so quickly, and your immunity to them, whether you're vaccinated or have had it, is so transient
or so specific
that there can never be herd immunity to this virus. Yep. And that's like a really important takeaway for people.
Yes.
Is that we're still chasing something that we now know is not possible with COVID. So we need a new strategy, because really the Republican strategy initially was herd immunity through infection, and the Democrat strategy is herd immunity through vaccination, neither of which will work for COVID. So we need other mitigations, and very specifically, we need ventilation and filtration to start bringing down that crazy amount of virus that's in the air right now all throughout the year.
James asked a good question. How did anyone ever expect a perfect vaccine with this being the case?
So
that's a really good question.
Well, the vaccines that we got actually were very effective.
Yes.
They were very effective vaccines. They've become less and less effective because this out of control spread of COVID has allowed COVID to mutate really quickly. That being said, there were people who were overly optimistic, who, like I said, actually did believe that you would only get COVID once, vaccinated or not. And these people were the ones that were elevated, both in the press and those who were advising Biden and advising the CDC. These people who said, it's okay, we're going to get herd immunity, they were all elevated. Now, when that didn't happen, we should have changed tactics. And instead, what happened is during that Omicron wave I'm talking about, where 200,000 people died in 10 weeks, 40% of them were vaccinated. Instead of changing tactics, they decided to try and brainwash you into accepting the new normal of you're going to get it every 8 months and it's fine. And nothing that we know about COVID implies that it would be fine to get this disease every 8 months. I mean, it causes cognitive damage frequently. And we're expecting kids to get it, I think it's like 1.4 times a year on average, maybe like 1.2 times a year on average for 18 years before they go to college. That's not going to be good for their brains. I mean, we're already seeing these test scores coming down kind of precipitously, and it's what you would expect to see if there's a huge population level decline in cognitive ability.
And this is, yes, it's infective, but all I'm saying is it evolved twice monthly. And yes, and I'm going to bring up one of the things Biden was talking about during the period where he was president-elect, but not president, because the scientists who were on his COVID group at the time were telling him this, was a 6-week shutdown for the entire country. No exceptions except for the most essential workers. No more governor discretion in handing out extra exceptions beyond the actual federal list of essential workers. Lots of restrictions about masking in public if you did have to go out. But this really, really excellent plan for a 6-week shutdown that would have coincided with everybody getting vaccinated. But that went out the window because he started listening to the once you're vaccinated, you're fine people as soon as he was actually president.
I mean, I think the problem is that they really just wanted, as you were saying, a silver bullet, and that's how they wanted to treat it. It would have been more effective to communicate that this was another tool in the arsenal, and that, for example, we are retrofitting all the buildings now, and we're going to do, as much airborne infection control as we can, and also here are the kinds of masks that work. So that's another thing that was never communicated. People were wearing cloth masks, people were wearing surgical masks. Yeah. These are not airborne tools. These are tools for a droplet spread infection, which COVID turned out not to be. So the fact that they never really explained that to the public means I still see people in surgical masks, and we still have doctors and nurses wearing surgical masks, which again are not airborne infection control.
It's true. Even the pharmacists at my pharmacy who are still masking because they're worried about catching something are wearing surgical masks.
It's such a failure. I mean, it's such a huge failure.
And the thing that both the anti-vax people and the pro-vax people miss, and I'm coming back to James's question here, there are very good vaccines, but nothing is perfect. There has never been a perfect vaccine that will 100% guarantee that you won't get a disease if you're exposed to it. There are very good vaccines that actually gave us herd immunity for things like mumps and measles and smallpox. But there's also a theory that because nobody now is vaccinated for smallpox, if smallpox actually came back, it would take years to build up the necessary herd immunity that our grandparents had. And the anti-vax people have this notion, if a vaccine isn't perfect, we shouldn't use it because it's bad. If it's not perfect, it's bad. Whereas the pro-vaccine people are like, vaccines are perfect. And it's really easy to pick holes in the vaccines are perfect argument if you're interested in doing so. Mm-hmm. The problem is that the reasons there are still good reasons vaccines mostly work, even though they're not perfect.
Yeah.
I will say, though, a lot of folks have their original shots and haven't been boosted. So
True.
even for the people who sort of are like, well, I'm vaxxed and relaxed,
Exactly.
is again a case of public health not explaining that a variant means that the virus is now genetically distinct from the one you got vaccinated against. Even characterizing the new shots as boosters, I mean, they're calling them boosters. The reality is they have a different virus.
Yes.
They have a new virus that is genetically different than the first vaccine you got, because the virus has changed so much.
It comes back to that you get a new flu shot every year.
Right.
And I remember people saying, well, what do they expect us to do? Keep getting a new COVID shot every year? Well, you get a flu shot every year, or you don't. And this raises a really good question. And it's not really, but I'm going to use this argument anyway, because it's used so often by people who are trying to undersell COVID and tell you why you shouldn't care. If COVID is really like the flu, then we should look closely at how much money companies lose because of the flu every year, and how many people die because of the flu every year, and consider that maybe we should be tougher on COVID, because all the things that protect you from COVID also protect you from the flu.
That's a very good point.
During the first year where people were actually following CDC COVID guidelines, the most common strain of the flu went completely extinct.
Yeah, and I think that's also
we've lost this news somehow.
I think that's also a good point to make, because parents especially are really complaining about this new level of sickness in society. It's, if we were to upgrade air quality and make it so that we have good quality ventilation, filtration, we're monitoring CO2 levels, it will not only drastically reduce the amount of COVID that's circulating, but it will also, of course, not only drastically reduce, but in some cases probably even extinct various other viruses, just because almost nothing that circulates on a daily basis is as common and as contagious as COVID. So, I mean, like a lot of these flu strains, it's much easier to control them. So if we did have high quality air filtration and also, if people were educated to the point where they wanted to mask and knew how to mask and all this other stuff. I mean, I don't think the days of having this like universal mask requirements in public spaces are probably coming back, although absolutely in hospitals they need to come back because that's infection control. But the people who are educated about what COVID is doing to their bodies, they really, really, by a large majority, mask. And we do it by choice because we know what's happening. And the people who don't mask don't know shit about what COVID does to your body. Like they don't. They think that it's a cold. So, I mean, if you want to change the amount of masking we have in society, we need that education. We need people to understand, oh yeah, your risk of a heart attack goes up drastically if you have COVID. Your risk of developing an autoimmune disease goes up drastically. Your risk of being disabled for life is quite high.
Your vulnerability to other diseases like RSV and the flu increases.
Right.
And I mean, James brings up,
it's if people aren't making an informed choice, if they're not being given the information about what COVID actually is doing to their bodies, and they're not. And I see it even in, like I was saying, like I have a friend whose dad got COVID a bunch of times, had a massive heart attack, had to have multiple heart surgery, like he doesn't understand that that's related to COVID and he's not protecting himself from COVID. But I'm sure if he was told, hey, COVID is very bad for your, not by me, not by my friend, by the CDC, and wear a mask, Yeah.
And James brings up something that I'm bringing up now because a lot of people believe it, but it's actually an anti-vaxxer myth. Case in point, the first polio vaccine was a nightmare. No, there was a contaminated batch of the first polio vaccine that actually poisoned people and was spun by anti-vaxxers as being the fault of the vaccine. It's tremendously important to understand that there are a lot of things that we believe are true in the media that aren't necessarily true. A lot of things that anti-vaxxers say sound true. Oh, if you get the measles, you're not going to get sick. So why should we trust a COVID vaccination that doesn't guarantee we won't get sick? Well, again, that's not how vaccines work. But
Right.
if you try to explain to people how vaccines work, they don't want to believe you. Even the anti-vaxxers don't want to believe how immunity and vaccines actually work, because even the anti-vaxxers have this incorrect idea about this whole immune system thing, that getting sick makes you less likely to get sick, that there's a difference between natural immunity and vaccine immunity. No, vaccines are one of the things that can strengthen your natural immunity, such as it is. Natural immunity comes from your immune system, which doesn't work 100% every time and sometimes needs help. And then viruses mutate, which is why you get a different flu vaccine every year, even though measles doesn't change very much. But, and I love this, but the more measles outbreaks we have at colleges because of immune systems being weakened by COVID and increasingly unvaccinated teenage populations, the more likely we're going to have of a strain of the measles that everybody starts getting again.
Right.
Mm-hmm.
This is like a race back in time. Like they are trying to take us back to the time before vaccinations and antibiotics.
And they're really succeeding. I mean, if you look at the rates of different viruses over the last 4 or 5 years, you will see, like I said, massive spike of RSV. We've got a massive spike in scarlet fever. We got a massive spike in strep A. You've got a massive spike now in tuberculosis. You have a massive spike literally. And if you look at any disease, we also have these invasive fungal infections, which are only usually a danger to immune compromised people. So do the math on that. There are more immune compromised people. This approach is going to dismantle hundreds of years of progress. And people are not willing to face up to what's happening, even as they themselves and their children, as they observe these impacts, as they're watching their kids get sick over and over. It's very bizarre.
There was an era where the average male lifespan in Western Europe was about 44, and the average female lifespan in Europe, with two sets of numbers, including maternal morbidity and not including maternal morbidity. If you didn't include maternal morbidity in the numbers, women lived about 48 years on average. And if you included maternal morbidity in the numbers, they lived about 35 years on average. This is to remind everyone how important reproductive health is.
Yes, please.
And we've also seen a drastic increase in dangerous births, as well as maternal mortality. Just in the last few years, we've seen this drastic increase. It's already bad in the US. But if you look, there was just a report that came out that said maternal mortality in the US now is as dangerous as it was during World War II. It's we've gone back and so quickly. And I also want to make the point that COVID is very dangerous to pregnant people. Pregnancy is a high risk condition. So you have all these pregnant women being told not to eat soft cheeses and they're not wearing masks. I mean, that is such bad medical advice.
Pregnancy used to be the number one killer of women.
Yeah.
It's incredibly dangerous, but COVID is dangerous for a fetus. It causes low birth rate. It causes birth defects. And it's dangerous for the mom. So please, if you're pregnant or you know pregnant people, wear a mask. If your doctor's not telling you this, they don't know what they're doing.
The three greatest advances in Western lifespan were penicillin, treating being pregnant like a medical condition instead of something normal like it was your cow, and vaccines. And, all of that seems like it's being unraveled.
Yeah.
Mm-hmm.
The right-wing campaign against abortion and birth control is a march back in time to the day when pregnancy and childbirth were the number one killer of women. The campaign against vaccines and public health regulations and infection protocols is going back in time to where more people died during wartime of disease than of combat.
Mm.
The number one killer in war, in the Napoleonic Wars, was not combat injury but smallpox. Typhus was the number one. Typhus and dysentery were the number one killers in the Civil War. And the Civil War, a whole lot of people got killed in combat.
Yeah.
But typhus and dysentery still killed more people in the Civil War. So you look at all this stuff, and they're trying to take us back to the days when we didn't live longer than 45.
Yeah.
They're trying to dismantle all of modern public health. And I think, when we talk about, I've heard this before when people are talking about sort of making fun of libertarians. It's like libertarians think that like they don't need anyone. And it's like, well, you drive on roads, you go to school, They don't understand. I'm sorry, but they really don't understand the implications of having no public health. And I know that they don't, because it's going to destroy the economy, and they don't actually want that. But again, they have this ableist Nazi mindset of, I'm going to be fine, everyone else is going to be fucked up, I'm really strong. And this is how they feel about everything. They think that there's no government, there's no society, I'm going to thrive, I'm going to be fine. And now we're living inside their fantasy. Like, oh, we don't need public health. The strong people will survive. No, what's happening is everyone's getting fucking sick all the time, and it sucks. Like,
yes.
And, there was an author
Chris,
in the 70s.
Wait, Chris.
William, go ahead.
I'm sorry. I just want to, for a second, I want to ask you a question. What happened to William Henry Harrison? How did that strong man die?
So
that's a perfect example.
William Henry Harrison gave the longest inaugural address in the history of the United States in the pouring rain. Caught the non-viral form of pneumonia that you can get, that when the bacteria builds up in your lungs because your immune system has been weakened somehow by environmental conditions, and died.
31 days.
Another one less well known is another strongman president, also a military hero, Zachary Taylor. Spent a long day in the hot sun, drinking probably sour milk kept cold by ice, and the theory that the ice in the milk would stop it from going sour, and eating cherries. And after this long day drinking probably sour milk that he didn't know was sour because of the cherries in it, he contracted acute gastroenteritis and died. So the first two presidents to die in office, both He-Man military heroes, died in office because they did stupid things they thought they could do because they were macho men.
Right. 100. Thank you for that.
Thank you for asking that question.
I had the idea in my head, and I was like, I gotta Google this, and I was like, shit, I'm just gonna ask you what the details are. I know you know everything.
I don't know everything, but I do know that. I know about Harrison because it's become like the ultimate example of why people shouldn't give long speeches.
Yeah, I think I heard about it originally on The West Wing in that context, but yes. It's a perfect example of why you should wear a coat and or not do things in the rain.
Lincoln always wore a coat, and people made fun of him. But Lincoln was also from Illinois. Lincoln lived in a part of the country that was only opened up to colonization because of William Henry Harrison. So he probably knew why William Henry Harrison died. And he always wore a coat, even though people made fun of him.
Are you going to argue with Abraham Lincoln? Huh? Are you gonna?
Everybody did. You have to understand how hated Abraham Lincoln was by the people who disliked him. I mean, they made fun of him for everything they could. His gloves were a poor man's idea of the gloves a rich man would wear. They went that far to try to insult Abraham Lincoln. He wears gloves like a poor man who's impersonating a rich man.
One thing I think is interesting about like the moment we're living in is that so we see all these diseases roaring back, and we see this record absences from schools and record sick days in workplaces and all this stuff. But like I was mentioning, we sort of lost a social norm of like, oh, viruses are bad. And I think it's partially because we have this arrogance of people who have been so well protected for hundreds of years. And now we've been sort of, in the last couple of years, sort of shoved into this morass of propaganda that like, oh, they're getting sick more, but that's good. But I did want to mention, I just thought of this because you're sort of going on a historical tangent. I'm reading In Search of Lost Time by Proust, and it's 7 books long. And one of the things that I found really interesting in these books, he's a sickly kid. He's sickly his whole life. He died at 51 of pneumonia, and growing up he had asthma, and it was known that he was sickly. So one of the things that happens in the books is that his parents are very concerned about him going to crowded indoor public spaces. So he wants to go to the theater. They're like, but you're kind of sickly. I don't really think you should be in the theater, because that's dangerous. So like in this time before vaccines, there was this public knowledge that like there are viruses in these spaces. We don't have the technology to control it. And it would be dangerous for you as a sick kid to get sick.
One of the fundamental plot devices of British Victorian children's literature is that a young girl or a young boy has to go to the country to live with relatives because they're sickly.
Right. They need to be away from people. They need to be in the fresh air. And
the whole fundamental plot of The Secret Garden is that the garden cures the sickly children, both the female protagonist who starts the story and and her cousin who she meets when she's moved in with her uncle. The being in the garden instead of in a city around other people makes them healthier.
Right. And also in the same plot line, a friend of his parents convinces them to let him go to the theater. And his argument is the theater has much better ventilation now.
Yes.
Better ventilation than it had 10 or 20 years ago.
Yes.
It was just fascinating to me that this book, written in the early 1900s, this part of the story is taking place in the late 1800s. These parents knew that having good ventilation was important for their kids' health. And now we're in fucking no man's land. Parents don't know shit.
This brings up a really great point.
That's an excellent point.
Back in the days when people could smoke on airlines, they had a rule about how the air had to be circulated and ventilated and expelled and new air brought in. When they banned smoking in airlines, they changed the ventilation on airplanes to recycle the same air over and over again. If they still filtered the air on airplanes the way they used to filter the air on airplanes when people smoked, we would read less about everybody getting sick after going back to visit their family for the holidays, before COVID.
I just want to throw some airborne nerd stuff in here, though. Keep in mind, though, ventilation is different from filtration. So although airplanes have very bad ventilation, they are supposed to, I'm not saying they all have it or anything, they do have really industrial HEPAs on the plane. And you will see people will post like, oh, the CO2 on here is really high. The HEPAs do not affect CO2. So that's like a really common misconception, that what the CO2 will tell you is if outdoor air is coming in, the HEPA is doing is pulling
but that said,
out of the air. So yes, I don't know the whole history of the ventilation, but I will say that even if you have high CO2 on an airplane, you can't really know what the particulars are if you have one of those.
If they're actually filtering it the way it should be, then no one should be getting that. Then we should not be seeing the sickness numbers we're seeing after flying.
I think it's good to assume that seeing what we're seeing with the other issues planes are having, that it's probable that a lot of those ventilation systems are not. And I would never.
If Max doesn't care that you can't disengage the autopilot before it, if Boeing doesn't care that you can't disengage the autopilot on the Max before it kills you, what would they care about the filtration for?
I think I don't think that anyone should assume that all of the HEPAs are working, but I do think it's important for the public to know that ventilation and filtration is just.
I don't want to terrify people.
To give a good example too. So I got
I bring this up because I'm sensitive to secondhand smoke, but I actually got sick less after flying when people smoked on planes.
Interesting.
I get a cold after flying every time now.
Oh, that's nuts.
Yeah, it's, I mean, definitely, you know, I usually wear KN95s if I'm just like running into a store. When I fly, I'll wear full N95, which is like the, you know, best type of mask for airborne infection control.
Here we go. I typed in the wrong window. My fault. On Twitter, the Gauntlet on Substack. Somebody was asking about Julia, so Julia's information is in the chat, folks.
Appreciated. Yeah.
And again, if you're on my mailing list, in the advertisement for the show that went out tonight, you can find the links to both Julia's Twitter and in her Substack and to her Substack. If you follow me on Substack and pay attention, both are shared on Substack notes. And the last thing, what was I going? Oh, my last. Did I ever get my last? I did. I got my tie-in to bring us back in time. So cool. So with that in mind, what are everybody else's final thoughts? Julia.
Final thoughts. I think that it's important not to lean into the feeling of hopelessness, because that's really the point of all the propaganda that's being thrown at us. I understand that it's not something you can solve individually, but it is absolutely something you can contribute to helping individually. And there are things you can do aside from masking in public is great. I do it. I think everyone should do it, even just for their own health. It's probably the most important thing you can do for your health right now, definitely more so even than going to the gym, because you're not going to be able to go to the gym if you're long-term disabled. So wear a mask in public, yes. Also start raising awareness about why you're doing that. Also look into the studies that are coming out about long COVID. There's a Dr. L. Alley, A-L-A-L-Y. He is a long COVID researcher who testified in front of the long COVID Senate hearing. He has done a bunch of research about all of the different long-term health effects that are following COVID, as well as the fact that your risk is cumulative across infections. He's just one of the many researchers that I recommend following. But also talk about clean air. If you can afford it, get a HEPA filter. If you can't afford it, look into joining some of these groups in your areas. There are mask blocks that distribute masks and tests for free. There are clean air clubs that are working on getting better filtration and ventilation into public spaces. Even if you can open windows, like if you see your kid's school and you're allowed to open windows, open the damn windows. Like that alone helps.
If you work at a company where you can write a request to HR for free N95 masks, the worst they can do is say no.
I think talking about it is also really critical. So I have quite a few friends in my close circle who always mask indoors and we test before we meet up. But unlike me, they don't talk about it on their social media. So I think people aren't seeing how many other folks are also participating in this. So like even just posting when there is a new study that comes out, or taking a picture of yourself in a mask, or sharing information about clean air. I think information sharing is really, really critical at this point, because before we're going to see any big social changes like new ventilation and filtration standards, we need people to be aware of what's even happening.
Yeah, I think that's the one simple thing I do is that when I take a lift, I wear a mask in somebody else's car because it's polite. I'm safe from their car and they're safe from me.
Definitely. I mean, I personally, I'm very committed to always masking indoors, but even if you do it some percentage of the time, so like, let's say you're like, but I really want to do indoor dining, wear it in the supermarket, wear it in these other environments where you're not actively eating or drinking. It's not going to hurt you, I promise. No. And it will help you other people.
I work on the phone, and sometimes it muffles my voice to try to talk through the mask on the phone. So I don't wear my mask at my desk, which is It's in a building. They filter it pretty well. I'm taking a chance. I should probably be safer, but I don't wear my mask at my desk, but I wear my mask every time I walk away from my desk and talk to my coworkers.
Mm-hmm.
Yeah, I think however you can reduce risk, like if you have to come into an office, which first of all, if you're working remotely, I would definitely lean on your coworkers about continuing to maintain that, because going back to the office doesn't make sense. They're only doing that for financial reasons.
The thing that helped us at my office more than anything is the fact that there are only 2/3 of the people in the building now. Because if you're exposed to fewer people, and you're not as, and it's easier for people to get away from each other, people aren't mixing this quite the same way they are before, and people aren't spreading as many bugs around.
Yep.
Everybody they can who's working remotely does it 2 weeks in a row and is only in one.
I do want to also clarify something about like airborne versus droplet, though, which is like if early in the pandemic, I know a lot of people still stick to this like 6 feet. You have to be 6 feet away.
That's like not quite the same.
That's a droplet rule, and we now know that COVID's fully airborne. That means it can hang in the air. So, for example, like when I go down the hallway and get on the elevator in my building, I always have my mask on, even if no one's around. Because if somebody was in that elevator in the last hour and had COVID, I literally can get COVID from the air. So
and I totally messed up the other day and took a selfie in an elevator without a mask, and that's on me.
That's just an example, but yeah, I mean, elevators are terrible ventilation, so it's a good place to have the mask on.
Yes, that's a really good point.
Yeah,
they have been better about. They have been less. Building owners have been less aggressive about resisting filtration requirements here. I think because we're a state where they have to follow a certain number of regulations anyway, and they found out that actually following the regulations is easier than fighting them. So maybe it's just inertia here, and I shouldn't read too much into it. But it seems like people here have been less concerned about denying reality and fighting every safety regulation than in some states.
I think I do think that there's very little reason to be against, clean air. And I think that people understanding that it's costing us this huge amount of money and that it's incredibly annoying to get sick all the time and that you're also risking disability, understanding all these things would create the public energy that we need to get these things accomplished. But yeah, I mean, we do need stronger standards. So right now, like the filtration standard in a lot of buildings is like MERV 6 or something, and we need it to be MERV 13 because MERV 13 is the level at which viruses will get filtered out.
And the reason mandates are important isn't because we're authoritarian and we love mandates. The reason mandates are important is because human nature is when somebody says you have to do something, your brain says we have to do it. Right. It's important. When people say you should do something, but it's okay if you don't, we're not going to mandate it.
Yeah,
and people say, well, if it was really important, they'd make me.
Right.
Exactly. And people are very, very social. So one thing I've definitely observed is that people, if other people are masking, they'll mask. If other people aren't masking, they'll mask. So having a rule that's like, hey, if you're coming into our space, wear a mask. Maybe there will be a couple people who are dicks about it. For the most part, nobody even cares much. I mean, just put it on. Like,
and the reverse, and that social tendency, the reverse is even people who would otherwise be masking in many cases have stopped because they don't want to feel self-conscious being the only one masking.
100%.
I watched this in a coworker who was better at masking than me for a long time, but eventually dropped her mask. And when she dropped hers, that's when I started masking again, because it really occurred to me how sloppy I was letting myself get because I felt self-conscious.
I think all my friends who mask, and myself included, like we've all encountered people who have made comments to us that are like, oh, I wish I could mask, or like, I wish I was doing that, or like, that's really smart. I actually sat next to, so the one time I've flown since the mask mandate was dropped, which that's a great example of a place that would be really great to have a mask mandate.
Yes.
I was sitting on a plane next to a guy who wasn't wearing a mask. He was very nice. We started chatting, and it was really wild. He was actually a respiratory therapist, and I was just explaining, you know, like how I work with, at the time I was working with some long COVID patients, and I was just saying like explaining why I wear the mask. And he was like, oh, I totally get why you wear the mask, because I'm a respiratory therapist and so many of my patients have permanent lung damage from COVID, and he wasn't wearing a mask. And I was like, oh, okay. And then he was like, yeah, as soon as I saw your mask, I was like, oh, I wish I had brought a mask. And I thought it was so interesting because, I mean, this guy is super nice. He obviously knows COVID causes
Nobody's
damage in
ever, none of my, when I have to take a lift, none of my Lyft drivers have ever said, why are you still wearing a mask? You shouldn't be masking.
I've had a lot of people be really nice to me, honestly. Now, I'm not saying, obviously.
I've seen the stories about people being assholes. I'm not denying that those people are out
there. It also depends where you live. Like, I live in Washington, D.C., but I've also gotten, you know.
If you live in Texas, it's really different from living in Oregon, I'm sure.
Yeah, yeah. and actually in Europe is like very anti-mask in like a weird way.
Well,
like, much worse.
I know why Europe is anti-mask, and it's the same reason New York City is anti-mask, and it has to do with the influence that cops have in urban politics.
Right.
Because the New York City started really, really getting negative about masking, or at least the mayor's office did. Even when at one point the public transportation people were trying to bring back mask requirements, the mayor's office has been very, very anti-mask. The excuse given, we're trying to protect retail business from robbery.
Right.
You know that the cops are handing him that line.
Yeah.
That's nuts, man.
Now the cops don't want people wearing masks because the cops want to see your face, or they want the surveillance camera to see your face.
Right. Mm-hmm.
They don't want the camera to see their face, but that's a whole nother argument.
Mm-hmm.
So now that we've jumped down all the rabbit holes from Julia's final thoughts, Bess, any final thoughts for you?
Well, if you want another quick rabbit hole, we were talking about morbid obesity and BMI, body mass index, right? I read a book that I cannot remember the name of, and it's driving me nuts. I've been trying to think of it this whole time. But that was based on an average, I think, that was taken in like 1940s. That's how our BMI index was created. So not only is this information completely out of date, but it's also based on an average. And the book's point was that the average itself does not represent a majority of the population. The population is a stratification that equals out to this average. So the average is actually representative of no one.
That's right.
So the body mass index in general needs to be completely reevaluated. So that's a complete different tangent, different jazz.
And this is why I was sort of hinting at this when I was talking about morbid obesity isn't what you think it is.
Yeah.
If morbid obesity has a medical definition based on the percentage of your body weight that is above the BMI, which means a lot of people who don't think of themselves as morbidly obese because they imagine that morbidly obese means the lady on my 600-pound life,
right,
are actually morbidly obese themselves and don't know it.
Absolutely, because the term morbid, when we talk about comorbidities, right, Julia, like the term morbid it means that you have, you're compounding a problem onto another problem, and you're increasing the likelihood.
One of the things,
but it doesn't necessarily mean that just because you are this level of fat, you are immediately prone to death.
One of the things that I believe ties directly into the number of young people and athletes dying is that athletes who build enough muscle mass are at risk of being morbidly obese by the BMI standard.
And I'll also add to that, I think another risk factor that's affecting athletes that are going on to get long COVID, that are going on to have heart attacks after COVID, is that they are not resting. They are working out because their norm is that they work out through everything, and their
norm is to be.
They either return to working out too quickly, or they never even stop, and that is really dangerous with a COVID infection. So I think everyone should do this as well. Rest, radical rest, is really, really important in a COVID infection. And I think this also goes back again to this very unscientific and sort of Nazi adjacent ableist view of health, which is health means always punishing your body and working out really, really hard. And if it feels bad, that's good. That's not really what health is at all for anybody. And working out it is good, but if you're sick and your body is fighting off a virus, it needs all of its energy to fight that virus. So don't work out through it. It is a very cardiac taxing virus. So you want to rest your heart, rest your body. It is okay. But yeah, a lot of athletes have a lot of ideas about not being able to rest.
Yeah, they're right about that. And especially since that, oh no, I lost it. Sorry.
My final thought is actually fairly simple. And it's something I've been thinking about and has developed as we've been talking about this, which is that Arthur C. Clarke said that any science that is too advanced for you to understand is indistinguishable from magic as far as you're concerned. Now, with that in mind, public health, whether it's as simple as washing your hands or as complicated as vaccines, public health is something that the average person doesn't really have a true understanding of and does not think of in accurate scientific senses in necessarily the same way that someone might understand a combustion engine. And as a result, public health becomes something magic to them, which then enables all sorts of magical thinking about public health.
Yep.
And I think we need to remember that it's not actually magic, and that this willingness to just assume something works because we don't understand it and it's always worked before leads to some of this magical thinking. I'm not saying everybody should understand everything about science, but there should be some understanding that, these things are actually scientific. People actually put effort into this. It's not just something somebody wrote on a sheet of paper because. It's not a spell.
I think if I could just add one thing to the final thoughts, I think that if people take away one thing from this, it should be getting sick is not good for you. You should try to avoid getting sick.
Yes.
And it has been a multi-year long process of trying to convince you of something that people have intuitively understood for millennia. Please don't fall for it, because you're really harming yourself and your children. You need to be concerned about this level of disease spread.
Try not to get sick.
Try not to get sick. Urge others to try not to get sick. Urge others to halt and mitigate disease spread. This should be very obvious.
Yes.
I think that's the perfect place for us to end the show. Thank you.
Thank you guys for having me.
Thank you for coming on. Bess, thanks for joining us. Everybody who watched, thank you for watching. These are the kinds of shows that I am happy to be able to do. And please share widely, like widely. And if you feel like you would like to support what we do here and people like Julia, please subscribe to her Substack, subscribe to my Patreon so I can subscribe to her Substack. Support us, please. If you can support us, we can keep trying to do our best to support you.
That's right. The best thing
everybody have. Sorry, go Bess.
No, you're good. The best thing for me is that you could follow me on Twitter. You can follow me on YouTube. And there is a link on my Twitter page that'll take you to places you can donate as well. But at this point, I'm just looking to build up my follower count, and then I'll make it easier for you to give me money. So thank you so much.
And we really appreciate it. I love everybody who watches the show. It's just I am thinking a little more these days about needing to be able to pay for the show, as things have been more static than they were before Elon Musk broke Twitter.
Mm-hmm.
And on that note, I hope everybody has a great long President's Day weekend, and we'll tweet at you.
All right.
Bye, y'all.
Thank you.